Thank you again for choosing Boston Vision for your vision correction surgery. This video is going to tell you all about the procedure and what to expect. First, you come into the office, you check in. You can expect to be here for about 2 to 3 hours. You will need a ride home from the procedure on the day of. You can take a cab or an Uber. We just have you sign a consent form if you choose to do so. Although we do recommend that you have a ride here. During those 2 to 3 hours, most of that time is pre-opping you, getting you ready for surgery. Our technicians kind of run you through the entire what to expect after surgery and the post-op surgery eye drop regimen. You will also be meeting with the surgeon if you have not done so already. We do some repeat testing on the day of surgery as well. And then we do give you a Xanax before the surgery if you choose to take it. It is optional. It just helps if you are feeling anxious, nervous. It'll help to kind of relax you before the surgery. We give time for that to set in as well. So when you are in the OR, if you are having LASIK surgery, you will be having 2 lasers, one that creates the flap and then one that reshapes the cornea. If you are having PRK, you will only have 1 laser, and that is the one that reshapes the cornea. The laser itself is 10 seconds at most, and then after the surgery, we do a quick check and then pretty much send you right home. With LASIK patients, we do recommend that you take about a 4-hour nap when you get home from the surgery. With PRK patients, that is not necessary. When you are sleeping at night, LASIK patients, you will be wearing shields to protect your eyes from any rubbing or scratching in your sleep. For PRK patients, we don't require it. For both LASIK and PRK patients, we recommend that you stay out of contacts 1 week before the surgery. Also, no eye makeup for 2 days before and 5 days after the surgery. With both surgeries, we do recommend that you stay away from swimming, hot tubs, jacuzzi, saunas, anything like that for 2 weeks after the procedure. Showering, washing your face is fine, just avoid getting soap or water directly in the eyes. We also recommend that you avoid lifting anything heavy, especially over 30 pounds, just to avoid any strain or pressure to the eyes. Working out is fine, just nothing too strenuous for about a week after while you are still healing from the procedure. We do recommend to try to avoid touching, rubbing the eyes after the surgery. We also recommend you get some over-the-counter, preservative-free artificial tears to help with any dryness that you might experience after the procedure. Keeping your eyes nice and lubricated after the procedure will help with any discomfort. If you have any other discomfort, Tylenol, Aleve, anything over the counter, proactively taking it around the clock will help with any of that discomfort. With PRK patients, we do call in a drop to your pharmacy, which is a numbing drop to help with any discomfort that you also might experience. For your LASIK and PRK surgery, you shouldn't feel much pain during the procedure itself. If anything, the only uncomfortable part is some pressure that you'll feel in the eyes. They do use a lot of drops throughout the procedure, so you will feel that when your eyes are getting lubricated with the drops. For PRK patients, we do put a contact lens in the eyes to protect your eyes for after surgery. This will be taken out at the 1-week follow-up appointment when you come in. If for any reason the contact lens falls out of the eyes, there is no need for you to come get it put back in or to put it back in yourself as long as you are not experiencing any pain at that point. LASIK patients, your vision should be pretty clear the next day, clear enough to even drive to the 1-day follow-up. PRK patients, you do want to plan to have a ride to the 1-day follow-up as your vision will still be blurry and hazy. Overall, it's normal to have blurriness, haziness after the procedure. Also very common to have any burning, itching, feeling sensations afterwards. This will subside pretty quickly with LASIK. With PRK, it might take a few more days for this to subside. For both LASIK and PRK patients, we do have you come in for a 1-day follow-up the next day. It is expected that you do come in for a 3 to 5 day follow-up with LASIK and a 1-week follow-up with PRK. Both patients will also be seen for a 6 to 8 week follow-up after surgery. For the best results for your procedure, it is very important that you concentrate on the green light during your procedure and make sure to keep your chin up. Here are a few final take-home points. It is normal to have burning and tearing for a few hours after surgery. Don't be surprised if your vision fluctuates in the first 2 to 3 weeks after surgery. Let us know if you need more sedation before going into the laser room. Feel free to speak up during the procedure if you notice any unexpected pain. Pressure and water around the eyes is normal. Most importantly, keep your chin way up and look at the green light when instructed by the surgeon. Thank you again for choosing Boston Vision with your vision correction surgery. We are thankful that you chose us and our Boston Vision team.